2026 is upon us, and that could mean new resolutions, new hopes, maybe a new hangover, depending on what you did on New Year's Eve. But it could also mean higher healthcare premiums. Hi, I'm Dave Price. This week, we get another perspective on Obamacare. So, how are you trying to add to the conversation? What are you all pushing for?
Yeah, so Iowans for Affordable Healthcare is supportive of extending the ACA tax credits for those folks that are on it. You know, our mission is to be the voice of patients here in Iowa. You know, there are groups that are supportive, you know, that have, backing the providers, backing the health insurance companies, backing hospitals, those types of things. And looking at sort of the landscape, we didn't see a group that was really supportive and giving the voice to patients. And ultimately, with all of the policies that get passed, a lot of times patients are the one that are having to deal with the brunt of those. And so we want to make sure that the issues and laws that are being passed are affordable for patients, seeing increases at the grocery store, increases in property taxes, increasing costs at the gas pump. So we just want to make sure that the policies that are passing are not hurting Iowans.
Okay, so what about this idea about not extending the enhanced premium tax credits and instead doing something like a federal health savings account to provide a structure like that instead? What's wrong with that concept?
Yeah, so the from what I understand, they're going to put about $1,500. That's kind of the number floating around for doing that. I think the problem is most people see that $1,500 going poof with within several months. Outside of employer insurance that picks up a lot of those costs, the individual plans, those premiums can go very quickly. And so while I think that there probably is some merit to that, I think the best policy is probably things that have been flushed out and not trying to get something done at the last minute. So that amount, that $1,500, I think most people would see that gone rather quickly.
Okay, so what if it were bigger? 2,500, 3 grand, 5 grand? I mean, is there a number that makes it work easier for folks?
I'm sure that there is, and that probably depends on the person, the family, the type of plan that they have. I think the thing that I think most people are trying to understand is this is a plan that's just coming together, maybe at the last minute, and those things needed to be fleshed out some more. And when we're dealing with health insurance and all of those things, those are such complicated issues, such complicated things. And so we want to make sure that the if something like that is passed, that it has been worked through, talked about, and not something that was just brought up at the last minute because we know that January 1st is just a couple weeks away.
In light of that, in light of starting anything new and the complexities involved in that, so is the most likely path, if anything happens, maybe a shorter extension for ACA, maybe a year, maybe even 2 years, as we have some folks pushing?
Yeah, it seems to be that in what I have read is
I'm
that
trying
there
to find
seems,
the solution here,
yeah, 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 yeah,
see if we
that
can pick
there,
the compromise.
yeah, that there seems to be some bipartisan support for doing sort of a 1 to 2 year extension,
Hmm.
looking at maybe some more parameters within the program. I'm read that GAO report that came out recently. And so, there is a bill in the House that has been put forward with bipartisan support. So maybe that might be the pathway forward, is that there is, maybe a 1 or 2 year extension with some guardrails around it. And then in the meantime, we know that we have a couple years, and if the Congress wants to do something different, they have time to really flesh that out and really come up with a proposal hopefully, knock on wood, that it is bipartisan and everybody can get on and support, and that will help those people that need those tax credits.
Guardrails to you means what?
Well, from what I have read, talking about potential, looking at income caps, looking at they're trying to kind of get rid of all the in that GAO report, the waste and fraud of folks that got subsidies that were not actual people. That so I think there are those types of guardrails that we would support. I mean, we want to make sure that the people that are getting these are actually ones that actually need it.
Let's see how 2024 compares with 2026. In 2024's elections, it seems like more Americans placed a higher priority when it came to economic matters rather than healthcare, and specifically the changes in abortion. Now, as we look ahead to the 2026 midterm elections and these changes in healthcare, where in this case has a more direct impact on people's financial situation, let's see if that combination pushes up healthcare on the priority list for voters this November. That is Inside Iowa Politics for this first week of 2026.